At its 238th inaugural lecture, the University of Nigeria convened a cross-section of stakeholders, health professionals, policymakers, academics, business leaders, students, and community figures, reflecting far-reaching relevance of the subject. Representing the Vice-Chancellor, Professor Simon Otoanya, the Deputy Vice-Chancellor in charge of administration, Dr. Josephat Onwumere, described the lecture as both timely and necessary. He pointed at the rising health concerns and the urgency of informed intervention.
Today's inaugural lecture is being delivered by our own Professor Kenechukwu, Iloh, Professor of Paediatrics at the University of Nigeria. Well, on behalf of the Vice Chancellor, Professor Simon Otoanya, I declare this inaugural lecture open.
The inaugural lecturer, Professor Kenechukwu Iloh, a consultant neonatologist and Professor of Paediatrics, delivered the compelling discourse titled A Normalized Tragedy, the Paradox of Life Ending at Birth and the Path to Survival in Nigeria. Drawing from decades of clinical experience and over 70 scholarly publications, Professor Iloh unpacked Nigeria's persistent neonatal mortality crisis, highlighting a troubling shift from culturally attributed causes in the past to largely preventable system-driven failures today.
When to deliver your accompany somebody, ask them about bag and mask. If they don't have it, please walk away from that place. And it must be the neonatal one, not the adult one, the big one, the very big one that you use to rupture their lungs. They don't need those big things. What they need is this, very small and quite effective.
He called on expectant mothers to avoid unregulated delivery centers while urging the government and private stakeholders to strengthen neonatal care, expand awareness, and close critical gaps in access to quality health care.
The call is for all of us to continue to raise awareness and then for us to invest in neonatal care. The government must start treating the neonatal mortality rate the way it should be, not with kids' glove, not with just talking. They must invest their money, they must invest in training, they must invest in equipment, they must invest in maintenance of the equipment that they have delivered to the hospital and track them to make sure that there is accountability in its use. And people should be punished. People that don't do well should be punished.
Chairman of the Senate Ceremonials Committee, Professor Ozioma Onuzulike, noted that inaugural lectures are more than academic rituals, describing them as platforms for translating research into real-world impact.
For the university, it is a way of helping the university community and the general public understand what is happening in the academia. It's like a town and gown event where the academia has a public engagement with the general public on these academic issues and how they reflect the society.
Colleagues in academia commended the depth and relevance of the lecture and its contribution to ongoing health discourse in Nigeria.
Professor Iloh is a wonderful person, a important personality and a distinguished academic. He has done a lot for Nigerian children, particularly for the very young, the newborns. And that's what this lecture has reflected. It was well delivered. It's a wake-up call that Nigeria needs to do more. We need to take our very young very serious and begin to think about how to save their life. It's an anomaly for babies to die at birth. It's an anomaly for newborns to be dying like if they are killing rats. It's time for all of us, all the stakeholders, to really stand up to it and say enough is enough and get our children to live.
For the wife and daughter, Professor Iloh's inaugural lecture is a moment of pride and reflection, describing his achievement as a new standard for the next generation.
I'm really proud of him. I'm glad today has come. He had wanted to do this for a bit, and I'm glad that today has finally come. I'm very proud of him. I'm proud of how well he delivered it. And I hope really that the message resonates in the minds and hearts of people so that the message is passed on today. It won't be something I'll just end after today. It's something that people remember and put into practice so that there can actually be a change in this neonatal mortality rate.
I feel very proud of him, honestly, because I know that he worked very hard to prepare for this inaugural lecture. And it's a sort of like inspiration to us, to me, as his daughter, to like do better and keep striving to achieve what he is.
The event also featured the presentation of awards and gifts. As conversations around healthcare reform continue, the presentation by the renowned professor is reminding stakeholders that saving lives at birth begins with fixing the systems meant to protect them. In Enugu, Christopher Lele, Signature TV News.